In this video, I'm going to demonstrate how physicians and providers can use nurse to enter orders. Nurse to enter orders can be used when a physician or a provider want to specify to a nurse to order a certain test, diagnostic, for example, when certain conditions or parameters or time have been met. To access nurse to enter orders, I'm going to go ahead and click the orders button at the top of the black navigation bar once I'm inside the patient's chart. By clicking the orders button, I can continue into the orders screen. Note that this patient doesn't have any current orders selected or active. From here, I'm going to click the enter button, and I can actually search for nurse to enter orders. And all of these nurse to enter orders are available for yourself as the physician or the provider to choose when you want a nurse to enter an order on behalf of you when certain conditions are met. So the example that I'll use in this scenario is the nurse to enter blood cultures if order. To order this, I'm going to go ahead and click the order to open up the different frequencies associated with this order. And I want the nurse to be able to order blood cultures PRN or as required. So I'll go ahead and click that. And the physician instructions that I'm going to specify if temp greater than 37.5. I can also use this blood cultures if temperatures above question over here, and I can actually specify the number itself. For yourself as a physician or provider, I would make sure that I just fill out the one that makes the most sense. Note that there are other nurse to enter orders available here. However, if I just go ahead and look at the CBC one, for example, there are different questions associated with each of these orders. For example, the CBC nurse to enter order would probably be used in the case of post-transfusion, and I can answer these questions as they apply. But for the sake of this demonstration, I will only use the nurse to enter blood cultures if temp greater than 37.5 order. Now I can go ahead and submit this order, and this order now will sit on the nursing side of the house. It will sit on their work list, and they'll be able to order this, and they'll be able to see this order so that if that temperature reaches greater than 37.5, the nurse can go ahead and order that order. I'm going to go ahead on the nursing side now and flip over, and I will show you what that looks like for the nurses. So if I just quickly flip over to the nursing side of the house and I go ahead and click refresh here, the nurses will notice that they get that order, and it will be in their acknowledge column, and the nurses can click on that acknowledge column and review that order. And once they've clicked the appropriate box and the nurse can review that order, they can see that this order exists if the temperature reaches greater than 37.5. So the nurse knows that if the temperature reaches greater than 37.5, they can go ahead and order that blood culture order. As the nurse, I'm going to go ahead and acknowledge that order, click save, and exit back to my status board. Now as the nurse, once I go into the patient's chart, notice that I have a nurse to enter order on my work list. So as the nurse, I can quickly see, if I need to order anything, if the temperature reaches greater than 37.5. And this is available on their work list, and they can see that. So from the physician's perspective, the physician can specify when that order should be ordered, and the nurse can carry out that action when required. Thank you.